Good morning, Sarah. Have a seat. Make yourself comfortable.
Thank
My
you.
name is Sheila Hardesty. I'm Dr. Miller's clinical nurse, and it's my job to check your vital signs and take some health history that he can review before he examines you.
All right.
We'll check your temperature. Okay, 98.7. And the finger there. And if you give me your arm, we'll check your blood pressure. Just relax your arm. How much do you weigh, Sarah?
160 pounds.
And how tall are you?
5'11".
Okay, your oxygen level's good, 98%. Blood pressure's good. 110/70, Sarah.
Okay.
Okay, if you could give me your full name
Sarah Ann Vance,
and let's see here, white female, your age,
33,
date of birth,
6/8/82,
and where were you born?
Oakland, Maryland.
Do you have a religious preference you would like listed?
Independent Baptist.
And what's your highest level of education?
I have an associate's degree.
And your occupation?
RN.
Registered nurse, okay. Your marital status?
I'm single.
Address?
7676 Maryland Highway, Swanton, Maryland, 21561.
And what's your current telephone number?
240-321-0099.
Okay. And how many members are in your household?
I have 2 children.
So that would be 3 with you. Okay, and what brings you to see us today? What's your chief concern?
I've been having pain in my abdominal area.
Does that hurt?
No.
Okay, and can you tell me a little bit about the pain?
It's like a cramping and a nauseating pain.
Okay. And how long's this been going on?
About a month.
Okay. Is there any associate events that lead up to bringing on the pain?
Not that I've noticed.
Any certain foods?
I did notice if I ate tomato-based foods or spicy foods like tacos.
Does any foods relieve it?
When I drink milk, that helps to settle it.
And has it affected your appetite?
Some.
Any weight loss?
I noticed I did lose 5 pounds.
How about your sleep?
It has started in the last 2 weeks.
Before this started, how many hours of uninterrupted sleep did you get a night?
8 hours.
And does this wake you up or keep you from going to sleep?
It keeps me from going to sleep.
So about how many hours are you getting now?
About 6. It takes me about 2 hours to get to sleep.
All right. Other than this problem, would you consider yourself fairly healthy?
Yes.
Okay. Let's see. Have you ever had any previous hospitalizations?
The birth of my 2 children,
And what years were they born?
2001 and 2008.
Any surgeries?
I was in a car accident and I had a splenectomy.
And what year was that?
2005.
Do you get annual pap smears
Yes.
and see the dentist regularly?
Yes.
Do you have any vision problems?
I do. I'm nearsightedness with astigmatism, so I wear contacts or glasses.
Okay. Okay, are your immunizations up to date?
Yes.
Have you ever had I was going to ask you about PPD, but I guess you do that annually being a nurse.
Yes.
Did you have a flu vaccine this year?
Yes.
And how about, have you ever had a pneumonia vaccine?
Yes, I have to get them every year due to having my spleen removed.
Any problems with routine blood work?
No.
Do you exercise?
No. I consider work my exercise.
That it is some days. Do you smoke?
Yes.
And how much per day?
About a half a pack.
Do you drink alcohol?
On occasion, like New Year's or family get-togethers, maybe 2 or 3 times a year.
Okay. How about your caffeine intake?
Normally it's about four sodas a day. If I'm working 16 hours, it could be 6.
Are you on any medications?
Celexa, 20 milligrams for depression.
Okay. And how about over-the-counter medicines?
I wasn't, but I started taking Tums and Pepcid C and Rolaids.
And that's for this problem.
Yes.
Does it help?
It does. It masks the pain, but it comes back. It's been
Helps the
resistant.
nausea?
Yes.
Okay. Are you on birth control?
Yes. Depo-Provera shot.
Okay. Do you have any allergies?
No.
Do you use recreational drugs?
No.
I'll ask you a little family history. I'm going to read some disorders and diseases, and if your parents, siblings, or children have these, or yourself, please respond.
Okay.
Heart disease and high blood pressure.
My mom and my grandfather has both.
Anyone have cancer?
No.
Anybody been treated for TB or
No.
tuberculosis? Has anyone ever had a stroke?
No.
Sickle cell disease?
No.
Cystic fibrosis?
No.
Anyone with epilepsy?
No.
Diabetes?
Yes, my mom and my grandfather.
Anyone suffer from gout or arthritis?
No.
Arthritis?
No.
Anyone have any sexually transmitted infections
No.
or sensory problems with vision or hearing?
No.
Any just genetic disorders in the family?
No.
Okay. Could you describe a typical day in your home life?
I wake up around 5 o'clock. I get ready for work. I start work at 6:30, and I usually work till around 2:30, unless I have to work over. And then I leave work. I come home. My kids get off the bus at 4 o'clock. I make supper. We do homework, activities, get them ready for bed, and then I watch TV, relax to try to get myself ready for bed.
Okay. Have you had any recent fevers?
No.
Any fatigue?
The last 2 weeks because of losing about 2 hours of sleep.
Okay, so this problem's affecting you pretty much daily then.
Yes.
All right. Nutritional wise, do you eat good, healthy meals?
For the most part, yes.
Having any problem with your skin? Any rashes, open areas?
No, I use a cream for acne, but besides that,
And you've had that problem since puberty?
yes.
Any problems with your hair or nails or abnormal growth of your hair and nails?
No.
How about your lymphatic system? Have you noticed any nodules in your neck or groin area that could be associated with infection?
No.
Any swelling or tenderness?
No.
Have you had recent headaches?
No.
Dizziness
No.
or syncope?
No.
Okay. And then the car accident you said you were in with the splenectomy, you didn't have any head trauma?
No.
Any problems with your eyes or ears?
No.
So you've never experienced tinnitus or vertigo?
No.
Had no eye surgeries?
No.
Had any problem with nasal polyps?
No.
Any recent respiratory infections?
No.
Any recent cough or shortness of breath?
No.
And no pain related to inspiration or expiration?
No.
Do you know how long it's been since you had a chest x-ray?
About 6 months.
You ever had an EKG?
No.
Do you do self-breast exams?
Yes.
Have you found any lumps or had any pain or tenderness?
No.
No discharge?
No.
How about vaginal discharge?
No.
This nausea you get from the pain, have you had any vomiting?
No.
Have you been constipated or experiencing any diarrhea?
No.
So your regular bowel habits, do your bowels move daily or every couple days?
Daily.
All right, I know you said you take the Depo-Provera shot so you wouldn't have regular periods, but before that, was your menstruation regular?
Yes. Before.
So you've never had any problems with your blood sugar?
No.
How about your thyroid?
No.
Have you experienced any hot and cold sweats, excessive thirst, or excessive urination?
No.
Frequency with urination?
No.
Have you had any changes in facial or body hair?
No.
Any musculoskeletal problems or joint stiffness?
No.
You've never had seizures, tremors?
No.
No problems with loss of memory?
No.
Psychological problems? You're taking this Alexa for the depression? Any other psychological issues?
No.
All right, Sarah. Well, I think I have a good health history here. I'll grab you a couple magazines and I'll see if the doctor's ready to examine you.
All right.
Make yourself comfortable.
Thanks.
Nice meeting you.
You too.